name is Dr. Sarah Spazieri, and I'm a podiatrist here at Christie Clinic, and I'm here today to talk to you about the dreaded heel pain. If you're a runner or any type of athlete or just somebody who's on their feet a lot, inevitably you will deal with heel pain at some point. Heel pain can be caused by many reasons. The most common reason, however, is usually related to something called plantar fasciitis. The plantar fascia is a ligament that's located on the bottom of the foot. It becomes inflamed oftentimes with increased activity or a change of activity, so it's extremely common to see in any type of competitive and even recreational athlete. Pain usually starts with increased activity and pain with activity after rest. First steps out of bed can often be excruciating and improve as the day goes on. Oftentimes people can sometimes even feel like they're swelling in the bottom of the foot or like they have a stone bruise. The pain does get better usually during the day for people, but again by the end of the day oftentimes reoccurs or gets worse. The good news is that we usually get rid of this conservatively, and most of the time it can be prevented if you do some conservative things before and after activities. The first thing I usually recommend for my patients is making sure they're wearing supportive shoe gear, especially with increased activity or with running. Usually one of the more common reasons we'll see this start is if people drastically increase their training regimen or if they're wearing a pair of shoes that are worn out. I often recommend that people go to a good shoe store and get properly fitted for a pair of sneakers. There are many types of sneakers available out there today. Most people will kind of go towards a middle of the road sneaker where there's some support and some cushion, but you also can get a very good motion controlled shoe, and there is also the newer technology of barefoot running or minimalist running, but I would recommend that this only be done with the help of a doctor or a trainer. The second thing that I recommend for most people is inserts or arch supports. There are some very good arch supports that are available over the counter, either through a good running store or your podiatrist. These inserts are usually easy to wear in most shoes, but they can be a little difficult in dress shoes. I often recommend that you slowly break into inserts. You don't want to go too quick, too fast, as you can make things worse. Some people will even proceed to custom orthotics, which are made for you. They can be a little bit more of an investment, but for the right person can definitely become part of your training and activity regimen, and I often describe them as glasses for people. Once you get used to wearing them, you always want to have them on. The next thing that we oftentimes recommend is some type of physical therapy or stretching. Stretching techniques can be found all over the internet and are super easy to do. I recommend that you do it especially before and after any type of activity. One of our favorite things is also to take a frozen water bottle or a golf ball and roll it on the bottom of the foot to help massage the plantar fascia. The plantar fascia usually gets more painful with less activity, secondary to the fact that it tightens up and people have difficulty with that otherwise. Some people will proceed to physical therapy or different types of massage therapy, such as A-stim, which are really great techniques for people to work out any type of tightness or even scar tissue within the plantar fascia. And then finally, there's always the idea of anti-inflammatories. You definitely want to consult your doctor prior to getting on any type of long-term anti-inflammatory regimen, but there are great over-the-counter topicals as well as ice that can be used to help reduce inflammation. On occasion, we will do more aggressive treatments, which include x-rays, physical therapy, an MRI, and sometimes even steroid injections, depending on the person and the course of pain. If you try these things at home and your pain isn't improving in the next few weeks, I oftentimes recommend that you do follow up with a podiatrist to make sure it's not another cause for your heel pain, as there are many other causes. And good luck to all the runners who are participating this year in the Christie Clinic Illinois Marathon, and we can't wait to see you at the finish line.